13 Pennsylvanians are dying every day from overdoses. Drug overdose is now the #1 cause of death under the age of 50. As medical professionals, we have a responsibility to respond using the best evidence-based treatment we have available. Opioid addiction can affect anyone. It doesn't matter how much money you make, your race, or your gender. While there are many routes to addiction, with time the paths become more and more similar. The disease can make it difficult or impossible to maintain relationships or keep a job. Addiction can drive those affected to say and do things they would never have imagined, even to those they care about the most. Often, opioid use disorder starts with a choice, but for those affected, it quickly becomes a far more destructive drive. Addiction is a hijacking of the brain by a life-threatening illness, and it doesn't stop at the individual. Opioid use disorder affects family, friends, co-workers, everyone in that person's community. As a healthcare team, we must look past the stigmas and perceived moral failings of those suffering from addiction. Given that so many young people are affected, the costs can be catastrophic, from hepatitis C and HIV to endocarditis, anoxic brain injury, not to mention the loss of lives. The effect on our communities is staggering. There are many treatment options available for those who seek help, but a treatment plan including medication-assisted treatment is one of the most effective ways to recover from opioid addiction. In this program, medication is only one part of a comprehensive treatment. Medication works to reduce opioid cravings. This makes the physical effects of recovery more tolerable and opens the door for counseling and other recovery support. While a treatment program with medication-assisted treatment is one of the most effective routes to recovery, everyone moves along that route at a different pace. Some may be on medication for months, while the counseling component can help bring understanding to a lifelong commitment involved with sustained recovery. The illness of addiction can many times feel lonely. It's important for patients to understand they are not alone. Even if an individual is not directly under your care, you still play a vital role in their recovery. Too often, we have failed to treat those struggling with addiction with the respect and support that we show people with other diseases. You can help change that. To understand whether or not a person is a good candidate for medication-assisted treatment, it's important to know the signs of addiction. Oftentimes, individuals are preoccupied with getting the drug, undeterred by the consequences of use. They don't think about criminal charges, stress to relationships, or the life-threatening risk of continuing use because their brain has been hijacked. In this fragile, critical state, we need to show people empathy and patience in order to be effective. Expressing confidence not only in the treatment, but in the individual's potential for recovery can make all the difference. When you talk with the individuals, start the dialogue with, "What has happened to you?" rather than, "What's wrong with you?" And when helping the patient take the next step to recovery, use a warm handoff to make sure you remain actively involved with the individual rather than just handing them a phone number. Make sure you stay in contact with the individual until the next caregiver has the ball. Recovery is hard. While it is likely patients will feel hopeless at times, recovery is possible. Our team must remain committed to working with these individuals at every level, every step of the way. We can only be effective in supporting someone if they believe we care about them, will not judge them, and will support them when they reach out for help, including with relapse, which is not uncommon and should be viewed as an opportunity to strengthen the person's recovery support, rather than viewing it as a failure. If you interact with an individual who may be ready for treatment, our 24/7 confidential access staff is ready to connect you with a recovery specialist and a support team in your local area. Call 1-844-PHILHAVEN